Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And we're keeping it current, keeping it topical this week, aren't we, Lynn?
We are. We're talking about the wildly hateful and ugly budget bill. So
yeah, what's hidden? What's disregarded? What are they doing with this?
Well, specifically as it relates to healthcare, and always looking for how's it going to affect the average Del Norter.
Right.
So, as you know, it passed the House, and it's up with 0 Democratic votes. So Huffman, hold the line, and is up for consideration in the Senate. But the general goals of the bill are to lower the tax burden on the richest people, like they actually have a burden, raise the debt limit to $4 trillion, and pay for cuts to Medicare, Medicaid, the Affordable Care Act, and the Supplemental Nutritional Assistance Program, which most people know as SNAP. And most people, just as a quick aside, Medicare is like what your grandma gets after she retires, or a disabled person gets. And Medi-Cal is what, in partnership, is what we call Medicaid.
In California.
In this state.
Yeah.
And OMAP in Oregon.
Okay.
So I looked at the data specifically from the Nonpartisan Congressional Budget Office, and this was published May 22nd, 2025, so hot off the press. Okay. And it looks at, in a nonpartisan way, it looks at what it thinks what will be the results of a specific act of legislation if it was passed. Okay.
Right.
So it looks like it's going to be passed. And they said it decreases or eliminates health coverage for 9 million people. So it's an anti-Affordable Care Act. It stops the tax credits that help buy marketplace insurance plans for people who are not on Medicaid, but who are on... like me, for a period of time when I had my own business, I was buying my health insurance on the marketplace in California.
Right.
And it screened me for, cash supplements for that or cash assistance for that, but I didn't qualify. So that means, and those are really, really high prices on the marketplace. So that's going to be a problem.
Wow.
And it will specifically decrease access to health care for immigrants, women, transgendered individuals, reproductive health care, and this was weird. It's going to remove nursing home staffing requirements, which are already horrible.
Right. Which are even like below the bare minimum.
And they can't even meet the criteria because it's such an awful job that nobody wants it.
Wow.
So,
okay. Well, as long as we have $1 trillion for defense.
Yeah. And parades on my birthday. So I think what's going to happen with immigrants is going to go back to what they used to have, which was called emergency only Medi-Cal. And so that means that, a migrante person is only going to have access to highly expensive ER.
Right.
When they need help, and they're going to get help later and more catastrophically.
And be more expensive and more of a burden for the rest of the
run.
Yeah, exactly. Jesus.
Really sad. I don't think that these government programs are going to cover any kind of gender affirming care for transgendered individuals. This is really horrible.
Yeah.
It's not just a little horrible, it's horrible to the nth degree.
I'm trying not to get started, the mood I'm in, but this is really...
I'm kind of hoping you are, actually.
Well,
we should express anger.
What is the reason? What's the purpose for our government? What is it here for?
Apparently to make people richer if you're in like a...
Apparently to make very few people richer.
Few. Yeah.
God.
This was interesting. There's going to be caps on those with chronic conditions and disability.
Wow, that's great. So what's your end here? What is the purpose of that? You're going to cut off money so that you can fund your tax cut and raise taxes for everybody else, too. There's lots of charts out there.
I don't think anybody has really... That would require compassion.
I'm not even compassion. It would require forethought. What happens to that person who is then capped?
Right.
Who takes care of them then?
Right.
Where do they
Exactly.
go? Jesus.
And there is a whiff of monetary consequences for people who have preventable disease. So they're going to shift from the current models, I guess, to take care of people who need care, and they're going to shift to value payment models, which is going to maintain, in which case maintaining the priority would be maintaining health. So what happens if somebody smokes for 20 years and they get cardiovascular disease, which is the common outcome of that? And what if they need a CABG, which is a coronary artery bypass graft, so their chest cracked and the vessels replaced? Is that going to be on their dime? That's probably over $100,000 surgery.
Wow.
Is it on the hospital's dime that maybe the hospital should just charge less? Is it on the surgeon and the surgical team's dime?
They don't care. They want us fighting over the crumbs.
Right.
They want us fighting each other over the
Exactly.
crumbs that they've allowed to fall down, to trickle
Exactly.
down to us.
What if you don't immunize your kid for measles, mumps, rubella, and they end up on a vent?
Well, then you get a government job.
Yeah.
Jesus Christ. I can't. I just can't with this. I can't with this BS. This is undermining the very notion of what a government is supposed to be.
And I don't think it's actually going to work. I mean, obviously.
No, it's going to burn. It's going to burn all
yeah.
around us, and we'll throw our
That's
hands
right.
up and go, oh, I don't know what happened.
Exactly.
Jesus.
And so I guess my thought is, thinking back, there was a period of time, I've said this on the air before, where people that had Medi-Cal, is what it was called at the time, had to pay $1 a visit as a copay. None of them paid it. I mean, after the first day, it just got around that if you just stare blankly at the receptionist who's
Who's
trying
going to come after your buck?
Yeah, nobody's going to come after you. They don't, I don't know how to say it really, but people who don't have money for healthcare and access it anyway are not really thinking about the consequences of it. They really aren't, because it's totally blown off. And so who's that going to hurt? What's that going to close down? Like maybe rural hospitals?
Yeah.
Maybe
yeah.
community clinics serving rural and isolated populations?
Right. If everything has a bottom line and a balance sheet, if everything has like some sort of justification that you have to have some sort of like a cost analysis, like it's a business.
Right.
Wow. Yeah. I don't. Okay.
So the other thing too is kind of an aside is once I was presented with a bill that somebody got accidentally from the ER, and she was shocked that her ER visit for a cold was like over $3,000, and she thought the bill was sent to her to make her feel bad, and she wanted me to look through it. It was itemized, and there's things like a Band-Aid costs like $50.
Right.
But it was true. Those were true costs, out-of-pocket costs for somebody who was uninsured. I think she accidentally left her Medi-Cal slide. And I said, I'm just going to look for the last 3 months how many times you've been in the ER. And it was something like 22 times in 3 months.
Wow.
And I said, yeah, this is at least what it costs every single time. And I'll note that you were going for stuff that I could have helped you with here for $250. Would have charged, that's what your payer would have paid. And they got mad and never spoke to me again. Like somehow it's a big game, or, somehow we're just trying to be mean. But really, this is a problem.
I can see how it could seem like a big game.
Well, it is kind of.
Yeah. Yeah.
But nobody's making that part up.
Right. Exactly.
Think about tariffs on China. What are, we think about, are they going to affect, this electronic device or that car and that important thing in our life? They're going to affect like the labels they put on the Band-Aid box. So effects of those tariffs are going to be ubiquitous. Plus they're going to force people at least to be responsible for paying it. I don't know if people are actually going to step up to the plate.
For paying medical costs, you mean?
Yeah, how do you get money out of a stone, really?
Yeah, exactly.
Really,
exactly.
You just harass people. They know how to not answer the phone.
Wow. Wow.
So how is this going to affect the community health centers? This is not an express goal, but I think the general trends are to force privatization on health centers.
Mm-hmm.
It's kind of interesting it's not an express goal because I think that would just drive people to madness.
Well, is that privatizing something like that? I mean, that's got to. I don't even have a concept of how much of a negative connotation is attached to that idea currently in the United States. I don't even know. For me, when I hear privatization of something like that, of something that's on the public wheel now, I'm so suspicious because that's just, okay, well, here's something right now as it is that exists, at least on paper, exists to provide a service for the betterment of society. Right. And we're going to turn that over it is expressed, like consciously expressed that their reason is to make money. And we're going to turn that whole thing over, and we're no longer going to be concerned with or be motivated by the justification that we're providing a service for people who constitute what our nation is. That's you and me providing a service. Now we're just going to turn it over to somebody who wants to get money from us. At the same time, on the back end and other pieces of legislation, we're going to deregulate all of that as well and just make it easy for them to charge for everything. Absolutely. And not have to provide any proof or any safeguards or guidelines.
Or not necessarily enforce EMTALA, which is, say you go to the ER and you have to be seen.
Yeah,
you can't be turned away, although people say it happens all the time. I find that hard to believe because, medical people are so trained not to turn people
Well, it
away.
might not be a functional turn like conscious, you've been turned away, but after 12 hours of sitting and waiting because of access limitations and the staffing limitations, then they're going to go, I'm going to leave.
And what would a organization whose primary goal is making money, how would they look at a community center, say in a rural impoverished community?
They wouldn't
care. Why not
care.
just sell it off for parts and then move out because it's not? I mean, you ever ask why we don't have Kaiser up here? There's no money making potential for Kaiser up here.
Exactly.
And unless the population explodes, like they shove Southern California up here, I doubt there's ever going to be something like a Kaiser. So what's going to happen to, Open Door, and what's going to happen to UIHS? I think UIHS has some legal things that they could rely on, like 100-year-old treaties and stuff that they might be able to save themselves. But Del Norte is suffering right now. Del Norte Community Health Center is suffering. And how about Stillat? And how is that going to be treated differently? There's a hot competition for patients on either side of that street. So do you get rewarded for praying over your patients as recommended care or data-driven medicine?
Wow.
I don't understand that. I don't know.
Yeah.
I'm throwing my hands up in the air.
Yeah, exactly. Because what recourse? Stop tearing down our government. Our government. Stop that.
And I think they're going to start by getting rid of programs that are actually important. So one would be Teen Clinic, highly vulnerable right now. Highly vulnerable. And one would be, for example, Dr. Turner's homeless clinic. We've talked about that before, that he has out in the parking lot with the showers and, there's food available and clothing available and medical care available.
So many people up at up the street at the last iteration when there were showers the Thursday before I left on my trip. The parking lot was filled with cars. And that's just separate from the people coming out of the bushes around here to go. There was showers and they had the mobile medical clinic. I mean, a lot of people in Del Norte rely on that.
He's seeing well over 20 people, I think, in a 4-hour clinic, which is a lot. And he does it gracefully, and he really is excited about it. He's quite the delight. But how are those? What if he decides they've all got hypertension for reasons that we could guess and not guess. And they all get handed medication to help lower their blood pressure. I mean, sometimes it's emergent. And how are those meds going to be provided? How are blood tests needed to decide which meds are safest going to be provided? How is nursing follow-up going to be provided? Are we all just going to do it for free?
Yeah. It's going to be like the 19th century. We're going to have to rely on
the kindness of strangers,
the kindness of those people that we end up celebrating and lauding for decades afterwards.
Right.
And the long shadows they cast and all of the things they changed. They were just individuals in the wilderness, and we're turning it all back to the wilderness again and hoping that those people step up again.
And how about the migrante community in Smith River? They have been there a long time, and Del Norte is pretty hostile to them. They're going to go back to an emergency medical system. Like they have to wait till they're dying to get care. And then it's not continuity care.
No.
It's just until you're able to leave the hospital, and then you're pitched back into the masses. That's like horrific. I don't know why anybody would come up here, which is maybe the goal. But the comparison that I made between medical care here and medical care in my experience in Yucatan, the light years more humane. Light years in Mexico more humane.
And more focused on things like preventative care and early involvement in things, and having pharmacies open 24 hours and things like access. So more invested in that because that's the cheapest thing to do, to help people initially and to help people stay as healthy as possible right at the very first interaction with the healthcare system, instead of sucking them in and taking all their money and kicking them back out. This is something here for the least amount of resources. We try to get you the most health involved, because that just makes sense when there aren't a lot of resources there. That's what they want for us, I guess.
And it's not just the community clinics in the hospital and then other programs that the community clinics support. It's like pharmacies. We talked to Mike Henderson about this, remember? And now Rite Aid goes down.
Yeah.
And this was expected for a long time, but I no longer have a way to write a prescription for somebody to take to Rite Aid. I don't have a prescription pad, and the electronics, it was taken. I can't even type it in. It says it's not an entity anymore. It's like if I tried to write an electronic prescription to Walmart, the computer just loses its mind and refuses to do it.
Why?
Because there's no. Sorry, not Walmart. Walgreens. Walgreens.
Gotcha.
Makes
Okay,
more
that's
sense.
good. Yeah, why?
There is no
not.
Walgreens entity.
Right.
And so what's going to happen, likely, although this is insider info, is that Rite Aid is going to be selling all of its prescriptions to CVS, which CVS is a great pharmacy, but you can tell they're getting a little tired of the burden. They took over Walgreens stuff, and they took over now Rite Aid stuff. Walmart is struggling to keep up. That's why a sick kid can't get a prescription in a couple of days. That's why what's happening at both the community clinic level and also UHS is that they have in-house pharmacies with selected formularies. And so if I'm worried about a kid on a Friday afternoon before a long weekend and they need this antibiotic today and Walmart's being sketchy, then I can talk to the nurse and likely hand it to them in the clinic. So that's starting to happen, but they're not going to be able to afford programs like that.
Right. Wow.
So people are going to suffer. So what's a concern Del Norter to do? Well, Coffee and Conversation is coming up on June 7th.
Very important one coming up, actually.
Very
yes.
important.
Yes.
At 11 a.m. to 1 p.m. And can I just have
Please.
an aside is that would be an impossible time for me to attend.
Of
and
course.
I can't imagine any healthcare provider being able to
maybe,
go unless they were retired.
Maybe some media organization will go and record or even broadcast that Coffee and Conversation.
I know, but I want my
live.
chance to yell.
Oh, gotcha. Okay.
And the person who is kind of leading the discussion is Mike Lane, CEO of Sutter Coast Hospital. So never met the guy. I've heard some good things about him. I think he's a change from previous leadership. But I want to know what that means for this hospital.
So I was at a recent, every year here in Del Norte, we have a thing, it's called the Economic Summit. And it's an all-day sort of dog and pony show where all the agencies and other people who have big brands or big brands in the fire for that particular economic topic or year get up and present to each other. And we had a keynote speaker du jour was the, I shouldn't say du jour, but he's always the keynote speaker at things like this, is Mike McGuire, State Senator Mike McGuire, the boy senator, I call him, because he's just so full of energy and he's so young. And he comes in and he like he does, and he's got all this information for everybody. And it was not good information, a lot of it. And a lot of his presentation was, I'm just going to be real. He kept saying, I'm going to be real. I'm not pulling any punches. And he was talking about budget cuts and, things that are being eliminated. And one of the things he shared was with this budget bill and the $800 million in Medicare and Medicaid cuts that it entailed at that point. And so he was saying, this is going to have a direct impact on Sutter. This is going to have a direct impact on Open Door. Right. And that's all he said, that there's a lot of people up here who rely on Medicare and Medicaid. After Mike McGuire spoke, Lane got up for Sutter, and he got into his presentation, had a bunch of staff up there, and they went through all these big things that Sutter's doing. It's a very exciting things, the empath unit that's coming, the kind of expansion of infrastructure and things they talked about here. But he took an aside and he said, I want to tell everybody, I want to reassure in light of what the senator had said, I want to reassure everybody here in this room, Sutter Coast is not closing. We're not going away. We will continue. And he had this whole thing where it's what he didn't share in this paragraph off the top of his head that he was just wanting to make sure that everybody understood, your health care isn't going to go away. It isn't. He did not say it wouldn't be affected.
Right.
He did not say it wouldn't be markedly less than it had been as far as access and capabilities were. He just was reassuring everybody that it wasn't going to go away. And I think the room was reassured. But what I heard were all the things he wasn't saying.
Right.
And so I'm hoping at this coffee and conversation that's coming up, this next one, these are hosted the first Saturday of every month here in Del Norte County by the local Democratic Party. And in the past, they've discussed things about like parks, and that's such a big deal in our community here, and national parks being gutted and state parks stepping up and dealing with things. He talked about, or they have talked about these things. This next one is going to be specifically a presentation from Lane and Sutter, and it will be addressing all of Del Norte's healthcare, because talk about Sutter, that's going to be a lot of Del Norte healthcare needs.
All right. So Coffee and Conversation, June 7th from 11 a.m. to 1 p.m. And it'll be Mike Lane, CEO of Sutter, and they will be at 785 L Street, and they're asking people to park on 3rd Street.
I can't imagine them keeping that there. This is just local stuff for our affiliates who air this air Health Matters in Curry County and Humboldt County, and then over in Klamath Falls, whichever county you're in, way over there. Klamath Falls County, I'll just say probably not. But you are all in, except even Humboldt. You're in rural communities. You're in communities that are going to be hit with all of these things too. What we're talking about is the Del Norte specific side and the conversation happening, but find out if those conversations are happening in your communities too. If they aren't, see what you can do to get them started, because everybody needs to understand here in red, rural, disregarded, forgotten America what all of these big headlines mean for us right here on the ground.
Right. Ironically, there is an Open Door in Klamath Falls, a community clinic called Open Door.
Oh, wow.
A different one.
A different one, but it's also open. So don't get confused, Klamath Falls.
Yeah.
We're not talking about we have a different Open Door here.
We have a different Open Door. So, but the community health centers are all over the United States. Pick a spot. There's probably one nearby.
Wow.
So.
Wow. Well, all I can say personally is if we do get to have a midterm election, that all of this will be remembered. That's what I certainly
hope so, and I hope that people get informed this time and are not so easily led astray by lies that are, easy to figure out, and not so much led astray by, I think, personal prejudices, and maybe make better decisions this time.
Yeah.
That would be really hopeful. So.
And I'm sorry about being so angry with all of this at the beginning. It's just so difficult to hear. It's so difficult to hear what's happening.
We should be angry.
Yeah, I know, but then what?
We should be angry in a productive way,
And
we
then
should
what?
move forward. So June 7th is our next and what?
There
and
you
then
go.
Maybe
Good.
on Health Matters we should talk about, what happened at that meeting.
That's a very good,
and what
yeah.
we are told.
That's
so
good.
next step. And I am angry. I could easily just retire and go to tend to my beehive. I don't need to have 60 hours a week trying to solve problems, complex medical problems with a shoebox full of resources.
Right.
But it matters to me. This community has always attracted me, always mattered to me, always, I think, benefited by kind of an out-of-the-box worldview. And so what do we do next? I go to work on Tuesday, is what I do.
Yeah.
But we should be at this meeting, and questions should be asked, not only of Sutter, but I wish the community clinic leaders, like Tori Starr, who's the leader of our Open Door, had been invited. He doesn't say much in meetings, and that worries me. And I know our Open Door, is struggling right now.
And that seems like that could be a very predictable sort of follow along from this next coffee and conversation is that, okay, well, you're here. Thanks,
Right.
Sutter. What about Open Door?
Then Dr. Stebbins, who is I think the chief medical officer of Stellant, which is actually a whole group of community clinics up around the Auburn area. And then a UHS representative. There's a lot of possibilities there, administrative and medical.
Okay. All right.
There's
Yeah.
land administrative leader.
And, as a community radio station here in the community, maybe if that isn't the case with this next coffee and conversations with the Democrats and just having Mike Lane there, maybe that's something we can help orchestrate, get some sort of summit, a healthcare summit just about.
Love it.
Yeah, that
Love
would
it.
be. Okay.
Yeah.
All right. Well, thank you for helping me turn that. Because really, I just want to punch things. It's time to turn the tables over. It's time to set things on fire. I'm beside myself how everybody's just sitting around perfectly complacent and keeping their eyes on their 401ks to see just how, what if this is affecting my retirement or not, while people are getting snatched off the street and our basic fundamental rights are being taken away from us, and the government that exists by us, for us, and of us is being dismantled right in front of us. And that to me is such a cause for alarm that I can't see.
If there was ever a time for fire and fury, it's now.
Yeah. Wow. Okay. Well, we have a couple minutes left. Is there some happy note we can leave things on?
Some happy note.
Let's see.
Yeah, I'm looking forward to hearing from the medical technologist who's back from vacation and is now talking about doing a show about that particular career. I think that's good. And I'm also excited about possibility of an acute care clinic in Smith River.
Ooh.
It's happened before through Del Norte.
Really?
I think it would be nice if somebody, the community that might benefit from that, can kind of put interest forward. Now would be a formative time.
Yeah. Wow. Okay.
Yeah.
Is there anything in Klamath?
There is a clinic in Klamath, and the usual provider there is moving in kind of toward retirement, but through a more administrative role. So they have a variety of providers moving through there. And, I think they're just going through a little bit of instability until they find the one that sticks.
That's if something in the Southern County and something here in Crescent City, of course, and something up in Smith
What
River.
I really want to see, though, is the mobile medical unit at Del Norte Community, and there's a smaller one at UHS. Go out to the summer festivals and the brush dances and, kind of pave the way for being at the, the basketball tournaments and all that exciting stuff, so we can have a medical presence there. And if people like turn their ankle and they're from out of the area, they've got a place to go. That's not necessarily the ER.
Yeah, that's a wow.
Super exciting. Not much administrative interest right now, but people could ask.
Yeah. Maybe we all need to get involved.
Yeah. There you go.
Right. Thank you very much, Lynn. Thank you for all of this, and we'll talk again next week.